City's public health clinics were closed today as they prepared for a dangerous chemical attack. KCTV5's Betsy Webster is live in Kansas City with what the simulation involved and where they're falling short. Betsy?
Well, Brad, about 70 staff members left the office here, the main office of the health department today, and went off-site, just like they would for an anthrax attack. It is something they actually did have to deal with on a much smaller scale shortly after 9/11, when some of the toxic powder was found in a local postal facility.
How are you doing today?
Good. But these lines are taking kind of long.
They're practicing efficiency all the way down to handling patients who are angry or scared. The Scottish Rite Temple is one of 10 designated points of dispensing, or pods, where people come for medication. Today, M&Ms are standing in for pills, which in reality would come from a federal stash maintained by the CDC.
In the event of a widespread sort of disease that we can treat with medication, we would open up these pods and have the public come in to distribute the medication as quickly as possible.
Which would really involve medicating the entire population of Kansas City within 24 to 48 hours.
They've got the organization down. Patients are color-coded with separate lines for red, yellow, and green.
Here's your medicine. Here's an information sheet about the medicine that you're taking. And just take this with you to the next station and they're going to help you get your vaccination. Okay?
The drill on the Phase 1 response happened 2 years ago. Now they're on Phase 2, 10 days into the outbreak, narrowing down who needs to continue their meds for a longer time and getting people vaccinated.
The biggest challenge that we have is surge capacity and the number of staff it would take to actually get an event like this to happen efficiently.
And in order to tackle that challenge, they're actually working with local businesses and agencies, the ones that have their own medical staff on site. We're talking about those larger businesses like Hallmark. They're training them to do all of that same work there in those medical clinics on site of those businesses. That'll take some of the burden off the health department. They're also working to get more volunteers trained to staff those health department sites. Live in Kansas City, Missouri, Betsy Webster, KCTV5 News.